Good afternoon. I have a question for you. Did you know the South has emerged as the epicenter of the American HIV epidemic, and San Antonio is one of its hotspots? The HIV epidemic affects the public as a whole, but seems to be a heavier burden for specific populations such as San Antonio. In our group, we are myself, Taylor Heap, Christina Griffin, John Jordan, Caitlin Mello, Gabriella Mayhew, and Adelaide, and we are nurses in and from San Antonio who are concerned about the disproportionate impact HIV and AIDS have had on our community. Education on HIV, screening, and pre-exposure prophylaxis is essential to reducing the spread of HIV, as it provides people with the knowledge and resources to protect themselves and others from infection. When taking as prescribed, pre-exposure prophylaxis, or PrEP, reduces the risk of contracting HIV from sex by approximately 99%. Major challenges to PrEP uptake in the South include low rates of health insurance coverage, low health literacy, stigma, low healthcare system capacity, and low HIV risk perception. Currently, in San Antonio, 72% of people with HIV know their status. 89% of people diagnosed with HIV are on treatments, and 89% of people on HIV treatment have undetectable viral loads. By promoting HIV screenings and increasing awareness of pre-exposure prophylaxis medication through our campaign, we aim to reduce the transmission rates of HIV among San Antonio's at-risk sexually active young adults, meet or exceed the city's 90-90-90 goal of 90% of people with HIV knowing their status, 90% of people diagnosed with HIV on treatments, and 90% of people on HIV treatment have undetectable viral loads, and ultimately disrupt the kinetics of the epidemic in the South.
In order to better understand how to revise and adjust our efforts in lowering the HIV transmission rate, we need to understand the current campaign strategies at both the federal and state levels. The Center for Disease Control runs a nationwide campaign called Let's Stop HIV Together. This campaign works within communities and as a resource hub to help people find services that offer HIV testing, HIV prevention and stigma education, and HIV treatment. The White House Office of National AIDS Policy is the reflection of the current president's strategy in the efforts against the HIV crisis, claiming to target a 75% reduction in new HIV infections by 2025 and a 90% reduction by 2030. The largest federal program in the Ryan White HIV/AIDS program, first established in 1990. This program provides funding for care, treatment, and preventative services to low-income and uninsured populations with HIV. So if you're somebody who's worried about the cost of treatment or maybe uninsured, Adelaide can actually help you with more information about the options and costs attributed to understanding your status and seeking treatment for HIV. The statewide campaign to reduce HIV transmission is Achieving Together Texas, whose goal is to make Texas a place where HIV is rare by ensuring access to preventative care and treatment to all who need it. The primary goal of Achieving Together Texas is to make it easier for anyone to have access to healthcare by understanding the data and populations that are at greatest risk for HIV in Texas, and working heavily in those communities, providing education, care, treatment, and support. In our city, San Antonio, the End Stigma End HIV Alliance is a compilation of all the HIV/AIDS organizations in San Antonio. They work together towards that 90-90 goal that Taylor was talking about. It's to increase the 83% of people with HIV who know their status to 90%, to increase the 72% of people diagnosed with HIV who are on treatments to 90%, and to increase the 89% of people who are on HIV treatments and have undetectable viral loads to 90%. They believe that the stigma surrounding HIV is a major contributor to the spread of HIV. Let's take a look at how these campaigns have played out locally with John.
Hey, so in 2017, as part of the Let's Stop HIV Together campaign that Christina talked about, the CDC began analyzing molecular HIV data on a national level. And to their shock, they found a cluster of 24 linked HIV cases from one city, San Antonio. When they dug deeper, they found that those 24 cases actually belonged to a network of 87 people with HIV, the largest cluster of cases in the nation. Most of the cases in San Antonio were among young, gay, and bisexual Hispanic or Latino men. Now, this tracks with the statistics I found for Bexar County showing that in 2020, of the roughly 300 new cases of HIV, 65% of them were Hispano, compared to the 13% of newly infected Black people and 17% of whites. I find it interesting when we compare this data to the demographics of Bexar County and see that given that the county is roughly 60% Hispanic, I would say it makes sense that around 60% of the new cases were in this population. But what shocked me was how the county is only around 7% Black, but this group then made up 13% of new cases and 14% of all the people living with HIV. So what's going on with these populations that they're hit so hard by the HIV epidemic? Well, the End HIV and campaign in San Antonio pointed to that stigma piece. San Antonio is a very conservative city, and for many young people, it's a challenge to come out as LGBT. Adding to that, the misperceptions about HIV positive individuals as promiscuous or dirty, and the fear and shame can be overwhelming. I can understand not wanting to be stigmatized even further by families or a partner if you get tested and end up with a positive result. This stigma should not be a barrier, though. Not knowing your status puts you at risk for developing complications from the virus and puts your partners at risk for contracting this incurable condition. Not knowing your status is how Texas is now ranked 7th in new HIV cases, and how here in San Antonio, those 87 people were able to spread the virus around. Especially in a post-COVID world, getting tested and knowing your status is a way to demonstrate your pride in your community and respect for yourself as a healthy adult. The End Stigma Health Initiative that grew out of the cluster identification in 2017 also found that when it comes to getting tested, many young people faced barriers to getting tested, like difficulty making appointments and long wait times. Moreover, when they made it to their appointments, many of them reported that they felt judged by the healthcare workers at these testing sites. And on behalf of nurses everywhere, I want to say I understand the prejudice that exists in healthcare, and I am sorry. That being said, steps have been taken in San Antonio to drastically lower wait times. And on average, a person seeking an appointment for HIV testing can be seen within 2 days, down from 14 days back in 2017. And according to data from 2022, around 65% of newly diagnosed cases were linked to HIV care. Another reason HIV rates might be so high in San Antonio is health literacy. Some people don't know what HIV is and how it's transmitted. This lack of understanding allows for the unknowing to spread the disease. We will provide some general information that may be helpful to your understanding, but additional information can be found at any of the many locations throughout the city that are available for you to get tested, many of which are run by LGBTQ organizations who are here to help you and support you. We encourage you to take note of these resources and thank you for taking responsibility for your health and getting tested.
It may feel a bit awkward to discuss such a personal topic, but we are here to break it down and hopefully reduce some stress surrounding HIV information. With little education openly provided, you may be feeling a bit lost on where to start. It may be difficult to navigate through the myths and discrimination that can unfortunately circle the topic of HIV. We want to provide the best information, stigma-free. What is HIV and why is this information important to know? HIV stands for Human Immunodeficiency Virus. This is a virus that damages the immune system and interferes with the body's ability to fight infection and disease. Knowing more about the transmission of this virus and available testing options is the key to end the HIV epidemic and take control of your own health. Skipping out on HIV education and testing has the potential to negatively affect your health. By knowing your HIV status, you gain the powerful information to keep you and potential partners healthy. Your HIV status will help reveal more options and opportunities in the exploration of treatments to prevent HIV if your test is negative, or receive treatment to reduce the viral load if your test is positive. Remember, undetectable equals untransmittable. Being aware of how HIV can be transmitted could greatly reduce the spread. This education is beneficial as primary protection from the transmission of HIV. HIV is not transmitted through saliva, sweat, tears, sharing toilets, sharing dishes, closed mouth kissing, mosquitoes, ticks, or through the air. HIV can be transmitted through blood, vaginal fluids, breast milk, pre-seminal fluid, semen, and rectal fluids. So, having vaginal or anal sex with someone who has HIV without using protection, such as condoms or medication to prevent/treat HIV, can result in the transmission of the virus. This is because mucous membranes, such as in the rectum, vagina, penis, or mouth, are coming into contact with the body fluids of someone who has HIV. The CDC recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of routine healthcare, and more often if you do things that might increase your risk for getting HIV, such as having unprotected sex. Many options are available to increase the access and convenience of testing. Rapid testing can be available at local clinics, as well as San Antonio AIDS Foundation, Kind Clinic, Beat AIDS, and Metro Health. If you feel more comfortable at-home testing kits are available. The CDC's Let's Stop HIV Together website is a great resource to help you find more information on HIV testing in your area. It provides a search engine which allows you to filter the HIV prevention services you are looking for within 1 to 50 miles of any zip code entered. This site also provides more in-depth information on HIV testing, prevention, treatment, and support.
There are 3 pre-exposure prophylaxis medications for HIV. Truvada, Descovy, and Apretude. Truvada and Descovy are in an oral tablet form, and Apretude is in an injectable form. Truvada is the most common drug given for pre-exposure prophylaxis. Truvada and Descovy, the 2 oral medications, need to be taken every day for 7 days to have a therapeutic effect for receptive anal sex, and every 21 days for receptive vaginal sex. It is recommended that individuals taking this medication should be tested every 3 to 6 months. Apretude is unavailable for females and is contraindicated for individuals who weigh less than 77 pounds. Overall, PrEP is safe, but some people do experience side effects like diarrhea, nausea, headache, fatigue, and stomach pain. These side effects usually go away over time. Additionally, PrEP reduces the risk of shedding HIV from sex by about 99% when taken as prescribed.
So we've discussed how you can get tested, the medications available to prevent the transmission of HIV, and why it's important to prevent the spread and transmission of HIV. Now we can discuss different options in order to afford testing or prophylaxis for those that are under or uninsured. There are a variety of different avenues in which someone might be able to gain financial assistance for HIV screening or prophylaxis. These resources are vital since the medication costs alone for PrEP can exceed $17,000 per year for those that are uninsured. Additionally, there is still a persistent issue with access to healthcare in the US. The number of uninsured, non-elderly individuals was 27.5 million in 2021. That fact, combined with the out-of-pocket costs of vital prophylactic medications for HIV, creates a situation in which certain sects of people in the US would not be able to afford essential and potentially life-saving health care. Different resources available for you include the University Health Family Focused AIDS Clinical Treatment Services, which provide comprehensive services including case management, mental health services, medical and pharmacy care, and more. The Ready Set PrEP program is available only if you have a negative HIV test prior to enrollment in the program and is for those that are uninsured. It does provide free PrEP medication for those enrolled in their program. There's also the Manufacturer's Medication Assistance Program, which is available for those with a household income less than 500% of the federal poverty level. This program partners with pharmaceutical companies that can sponsor these programs that will offer financial assistance or free drug products to low-income individuals. There's also the Patient Advocate Foundation Copay Relief, which provides financial assistance to those with a household income of less than 400% of the federal poverty level and helps with out-of-pocket costs of medications, screening, and more. Lastly, Medicaid, Medicare, and all ACA plans are required to cover HIV testing and Truvada prescriptions. There's also the list of grants available on the CDC website that can also provide financial aid and assistance to those who are under or uninsured. All of the aforementioned programs provide avenues for individuals to afford life-saving preventative care with regards to HIV. Cost should never be a barrier to effective and essential health care.
Wrap it up. By increasing the number of people with access to HIV/AIDS related care, improving knowledge of the disease process and its transmission, and increasing the amount of people aware of their health status, the number of cases can decline. We hope to go from a hot spot to the forefront of prevention by having a near 95% rate of HIV positive individuals who are aware of their status and a decrease in new infections by 30% by 2030. It is critical to take the steps to address what is addressable now, especially when the resources are available to promote self-efficacy and reduce risk. Now that you know how important it is to know your status, the resources that are available, and how HIV impacts our community, we call on you to take this information and put it into action. Thank you.